My name is Josie Dornbush, and today we will be sharing a video tutorial on how to perform the two-catheter urethral catheterization technique. This technique was designed for use of placement of urethral catheters in female cats and female small dogs that are too small to allow concurrent digital palpation. This method is a helpful modification that can be used in a challenging subset of patients to improve the accuracy of urethral catheterization. Funding for a clinical prospective trial evaluating this technique compared to traditional methods was provided by the AKC Canine Health Foundation, and the authors do not have any conflicts of interest to disclose. Animals that may benefit from this modified technique include cats or any female dog that is too small for digital palpation. This can include puppies or toy breeds. As a general guideline, we have historically used 10 kilograms or less as a rough cutoff for patients that could qualify for this method. Supplies needed for catheterization include all of the supplies you would generally use for urethral catheterization, plus an additional larger catheter, generally a red rubber catheter, that will be used to occlude the vaginal canal. In dogs, this is an 18 French, and in cats, a 10 French can be used. In this animated video here, the larger red rubber catheter is placed into the vaginal canal and advanced until it meets gentle resistance at the cervix. Then, using the non-dominant hand, is reflected up and held out of the way. The smaller urethral catheter can then be fed with the dominant hand just underneath the larger catheter, directed ventrally into the urethral papilla. The larger catheter within the vaginal canal helps direct the smaller urethral catheter into the papilla, similarly to how a finger would be used during digital palpation in larger patients. Of note, the urethral catheter can be any type of catheter, such as a red rubber catheter for urine sampling or a Foley when an indwelling catheter is needed. In the cat or small puppy, the distance the vaginal catheter feeds until it touches the cervix may not be very far, and care should be taken to not attempt to advance the catheter further once gentle resistance is met. In this video clip, the two-catheter technique is performed on an anesthetized female cat. The patient is in sternal recumbency with a rolled-up towel placed underneath the caudal abdomen to tilt the pelvis for better exposure. The larger red rubber catheter is placed into the vaginal canal and reflected up out of the way. Following this, the smaller urinary catheter can be fed smoothly underneath the larger catheter and into the urethral papilla.